I'm Janelle Marie. Welcome back to Body Beautiful. We are here with Dr. Joseph Mealy, plastic surgeon, talking about all kinds of things. And our final one, Dr. Mealy, will be
arm lifts.
Brachioplasty.
There you go.
I always have to say the big words.
I like the big words.
All right.
I know what they mean.
Hey, you do, don't you?
That's why we go to medical school for so long.
Let's tell
to
our
learn new
viewers.
words for the same stuff.
Well, let's tell our viewers, what does brachioplasty
So brachioplasty
mean?
it literally means arm changing,
Oh.
but in this case, we're removing extra skin. So
Arm lifts, bat
arm lifts,
wings.
usually because of weight loss.
Yes,
So when
absolutely.
someone's been heavier, their arm gets bigger. When they lose weight, just like on the belly, we lose the fat, but the skin remains.
Picture
So
number
arm lifts
one.
remove that extra skin.
How is it performed?
So in this case, there's an incision made from the elbow to the armpit.
Underneath,
Yes.
okay.
So what I try and do is put it on the lower part of the arm, so in most positions it's hidden.
Good.
So if your hands are up, then you're going to see it. But if your hands are down at the side, it should be along the
Not
body.
too bad. It fades after time.
It does fade, but the scar is the thing I like the least about arm lifts.
I know.
If I could have a skin shrinking ray and not have a scar, I would be a very happy plastic
We're still
surgeon.
looking for that ray.
Yes. So in this case, the incision also goes down the side a little bit because she had a little
Okay.
bit of extra skin hanging over the bra. And also, if you notice, her skin is way below her
Yes.
armpit. So I need to close the side along the side vertically and the side along the arm along the arm. So that's why we get this little bit of a scar coming down the side of the body.
It looks fantastic, though. The
It
after
works.
picture is amazing, very natural, and you can't really see the scar, but it looks great. I mean, it's
And the other thing
all
that's
sewn
really
out
nice
there.
for the patients is they can fit in a normal sleeve.
exactly. You can wear sleeveless shirts, or when it gets
Or a
summer.
sleeve shirt.
Exactly.
'Cause sometimes there's so much you can't get a sleeve on.
That's a good
Yeah.
point. Picture number
So
two.
in this case, really easy to see where the arm should be.
Yeah.
And then there's all that
That's
extra
true.
skin. So essentially what I'm doing is just getting rid of that extra skin and tailoring it, tightening it up.
And picture number three. Can these be performed with other, surgeries? Can you?
Often they are.
Oh, they
'cause
are.
Often these are weight loss patients who've lost
Gotcha.
100, 200 pounds. So
Maybe.
they're loose in their arms, their breasts, their bellies. So often I'll combine this with a lot of the breast work. So we're just working on one part of the body and then maybe later do tummies and thighs.
So gastric bypass. A lot of patients come
Yes.
in with loose skin. They want it gone.
Yes,
Gotcha.
the skin grows as we grow, but it
Oh,
does
yeah,
not
I
shrink
know.
as we shrink.
Why? It does when you're younger, maybe, but as you get older, it's a little harder.
Yeah, it
Oh,
doesn't.
no?
No, I've had 18-year-olds who had bypass surgery
Really?
that still had extra skin. Yeah, it did not shrink,
Okay.
sadly.
That's not good.
Nope.
And
So
fourth
another
picture?
case, so in this case, we've got a little better dip at the arm. We can see the skin going up towards the armpit.
not as bad, yeah.
So that usually makes that vertical scar much shorter.
Mm-hmm.
And then her skin, it was just loose. Her arm was tight. She had good muscular tone. There was no extra fat there.
Yeah, no.
And it's just
so
skin.
that's just all skin.
Yep.
And you can tell if it's skin or skin and fat. I mean, it's
Yeah, you pinch it.
and that's
so if
it.
it pinches fatter, there's fat in there.
You can tell, so you know what
That's
to do.
the term fatter. But that fat goes away with the skin.
Oh, it does.
So if
Okay.
someone has fat on the top of the arm, which is unusual, but
Yeah.
once in a while they will, then I can do some liposuction up in there too. But usually for this, I just remove it
now,
directly.
what about recovery period for this? If you want to go back to working out or something like that, how long?
So recovery, you're wearing a garment for a couple weeks, which gives some compression and support there.
Mm-hmm.
The hands sometimes swell a little bit, so a lot of excess use of the hands I usually try to limit for a couple of weeks.
And what about men? Are you seeing a lot more men coming in for this kind of surgery, or is it?
Sure, yeah, men arms do the same thing.
Do they really after
Yeah.
weight loss?
So
well,
we try to get rid of that extra skin.
it's the women that mostly don't want the bat wings, right? But it tends to be the.
Well, men are annoyed by it too.
Okay, good to
Yeah,
know.
but they're annoyed more by their chest and their bellies like women
That's
are
true.
too. So usually those come first.
Good to know everybody's got something, right?
Yeah.
And our final picture.
So same thing here. So this is someone with a little bit of sun damage to their skin too. So that
Yes.
that means the skin's a little more like canvas, less like rubber.
Gotcha.
So in those cases, I have to tighten it a little bit more. Little more chance of it loosening up.
It looks
So-
fantastic. Very
so in
natural.
her case, I did go down on the side, and if she had better elasticity, I wouldn't have had to.
Yeah.
But it all works.
Unfortunately, guess what? We've come to the end of the show. We are out of
Oh.
time. I'm so sorry.
I hate when that happens.
I do too.
It's way too fast.
We want to thank you so much, Dr. Mealy, for everything. And if you want to contact Dr. Mealy, just give him a call at the office. That's 925-943-6353, or go on the web, drmealy.com, sanfranciscobreast.com. Before and after pictures are there. Everything you need to
Lots
know,
of
right?
stuff there. More information.
More information is there. Thank you so much, Dr. Mealy. See you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.